Hello everyone, I am Dr. Sarrath Rathnaraajan, ENT and head and neck surgeon. So today I would like to brief upon a very important emerging problem which is called as obstructive sleep apnea. So what is obstructive sleep apnea? It's a blockage in your upper respiratory tract. So what happens? So the patient, when they go to sleep, what happens is like because of negative pressure in their upper airway, the upper airway collapses and it completely blocks. So what happens to the patient is they'll start snoring. So the patient will not know anything else apart from snoring, so which they themselves will know when it's very loud or when their partner complains that the person is snoring loud. So later on, when this keeps going on, when it gets aggravated or gets severe, they start to develop symptoms. The most common symptom, as everybody knows, is snoring. The second one is going to be of tiredness, daytime sleepiness, fatigability, and they'll have dryness of mouth. They'll have early morning headaches. They can also have sometimes drooling of saliva. And some patients, when the condition is very severe, they do have choking episodes at night. The problem is the patient will come to know only about the problem when it gets severe. So till then, he'll be living with this, he'll be sleeping with the same thing. So even if he sleeps for 10 hours, the quality of sleep what he gets is very poor. So this will affect the productivity of the person. So why is this of a major concern? So what happens is when there's an apnea, so you don't breathe in oxygen. So there'll be a cessation of breathing. The most important organ which functions during your sleep is your heart. So your heart fails to sense it and it starts to beat faster. So this happens every time you go to sleep. So whenever there's an apnea, the heart will start beating faster. So this will eventually lead to an increased blood pressure, which can also lead to a cardiac arrest. And in some conditions where when they have a severe apnea, they can also have a stroke. So this is the major concern why we are worried about sleep apneas. So how do you go about it? So once you know that you're snoring, so it's very simple, easy diagnostic procedure. So we'll have a sleep study which will be done, and then we'll have imaging which will tell us more information. And some patients who we think surgery might be required, we'll also do a drug-induced sleep endoscopy. So with all this information, so we'll be able to make a tailor-made treatment plan for that patient. So if you know somebody who's snoring, or if you think you're yourself snoring, please go meet a doctor. It could be an ENT doctor or it could be a pulmonologist. At Sooriya Hospitals, we, a team of ENT and a pulmonologist, have a complete setup to diagnose obstructive sleep apnea. We can do your entire evaluation here, and we can come up with a solution based on your problem and whatever is required after that. We'll take care of your problem. Thank you.